Late. This calls to order the regular Boulder County Board of Health meeting. It is Monday, May 13th, 2024. It is 5:38 p.m. And I think we're going to start with our roll call. Yeah, so I am Morgan McMillan, President of the Board of Health. Welcome, everyone.
Vice President Bacon. Oh, we can't hear you, Landry. You hear us, Landry? Can't hear you. I'll move on to Board President or Board Member Harrison here. Board Member Hemmon is not here. Board Member Johnson here. Vice President Bacon. Okay, I see your mouth. Oh, you're here. I'll let you keep working on it. Okay, so we do have a quorum.
Great. Okay, item number 1 on the agenda is public comments. And before we begin those, I'm going to read a brief statement. The Board of Health provides the opportunity for the public to share their viewpoints and opinion on public health matters. It is not the practice of the Board of Health or agency staff, many of whom are top experts in their field, review, vet for accuracy or grounding in scientific evidence, or provide responses to public comments at Board of Health meetings. Opinions expressed by the public should not necessarily be interpreted as accurate if staff or the board does not challenge the perspective.
Can you hear me now?
Yes, can hear
Okay, got it. Okay, I'm present.
Thank you. All right, thank you to those who signed up for public comment. I will call on your name in the order of the comment submission. You will have 3 minutes to speak, and I'll give you a 30-second warning when your 3 minutes will be up. And at the end of your 3 minutes, you will need to conclude your comments. So the first member of the public signed up is Ryan Scott. So Ryan, I will make you a presenter, and your 3 minutes will start whenever you're ready.
Super. Thanks much. I didn't have an opportunity to join last time, so I know I signed up. Appreciate being here again. I've seen many of you on here before, as you likely remember my face, because there's not that many people that join. I just wanted to note one thing about the March meeting. I know Keith got up and gave some statistics. The MMWR statistics that were given, those were an estimate, so you should state that as such. So please don't strip that out next time. It does change the context of what you're saying. I think to get people up to speed, you know, there's obviously been a lot of folks in your department, Greg and others, that have transitioned through, you know, like a bad dream. COVID finally faded away. I saw you guys wiped it from your site within the last month, so good job on that. You know, the political sphere having shifted to other more pressing, you know, items. I think you certainly created a hyper medicalized dystopia back during that time. And, you know, everything became antisocial, and you implemented a lot of measures that were entirely nonsensical. So I'd like to highlight that the J&J vaccine was pulled off market. As you likely already know, AstraZeneca just pulled their vaccine off market worldwide due to rare side effects such as blood clots and low blood platelet counts. Seems a little, seems like a bad ominous warning for something you guys were pushing as safe and effective a few years ago. So just like to point those pieces out. I think public health authorities like yourself, you need to wake up a bit more. And I wish you would challenge the folks that get up and speak to you, and don't just let it pass by, give your disclaimer in the beginning. Open up a debate and counter some of the things I say. That would be refreshing. It would be refreshing to see you admit your mistakes, right? So I think you need to draw a line in the sand in terms of how you approach these things next time, right? I'm not naive to think, oh, this is the last time. Well, I can't wait till we get, you know, influenza 101 coming down the pipeline, and you guys are pushing everyone to get vaccinated again rather than get out and get healthy. Don't do that. One last thing I'll highlight, Moderna's sales have fallen 91%. Their total revenue for the first quarter of 2024 was 167 million compared to 1.9 billion for the same period in 2023. If you don't think that money corrupts an industry, and you think that pharmaceutical industry is exempt from that, that's naivety on another scale. So just keep that tucked in the back of your mind. Profit drives greed. Greed's a very salient motivation in a number of different things. don't be so naive to think that these people are altruistic. And I thought there'd be more people in Boulder that would stand up against this, but you guys took a very different approach. And unfortunately, you were all one-sided. So I know you guys have pushed on. Glad to see that. No one's getting boosters anymore. Congrats.
That's time.
Look forward. Thanks.
Thank you, Brian. Restarting. Thank you. All right, next we have Mohammed Kouzias, so make you a presenter. And your 3 minutes will start whenever you're ready.
Hi, can you guys hear me, see me?
Yes, we can hear you,
Yes.
and we can see you.
Excellent. Hi, everybody. I'm a local pediatrician practicing in Boulder in the Denver metropolitan area. I wanted to speak to you today about how you can help protect and enrich the lives of children abroad and domestically. I'm sure you've all seen the horrifying images coming out of Gaza, where over 17,000 children have been killed. While what is happening is a tragedy and a genocide by any measure of the word, we as empowered members of the community must act. The American Academy of Pediatrics in February released a statement discussing the effects of armed conflict on children and recommends 5 actions that should be taken to protect kids, specifically in war zones. While Palestine may seem like a faraway problem, the horrors faced by those children there directly affect kids here. The AAP has reported on the sharp rise in targeted racist attacks on Palestinian and Jewish children in the United States in their own country. The board must take a strong stance against anti-Semitism and anti-Palestine bias. These attacks threaten the safety and security children feel within our community and can lead to lifelong psychological harm. Therefore, first and foremost, I ask the board to come out with a strong statement in support of protection of our children from the cancers of racism and bigotry. Second, I wanted to focus on the cost that the support for the state of Israel and its genocide has had on our local community. In addition to the isolation our selective support for one party creates, we're literally robbing our communities of critical resources needed here. MLK famously said, "The bombs in Vietnam explode at home. They destroy the hopes and possibilities for a decent America." Let me ask you why within Boulder year on year, we have seen an increase in food insecurity in our kids. Since the pandemic, the number of food insecure children in Boulder has nearly doubled. Children who are hungry at a higher risk for illnesses and have poor educational outcomes, setting them up for further difficulty in the future. Make no mistake, this is a public health crisis, and we need a strong statement against against the reinvestment of our tax dollars into a war, and instead sending them towards dealing with this ever-increasing issue. Finally, in addition to this, homelessness continues to rise. I've spent the past 2 weeks working in a local homeless encampment providing medical services. I did this because when I was asked where to take people who are sick and why there was no one else doing it, I was told there is no funding available to expand programs to include our migrant brethren. While I found parents who are doing their absolute best to ensure their kids are well fed and taken care of, they're constantly under threat of police assault. Multiple studies highlight the effects of housing insecurity and repeat negative interactions with police on children at an early age. Therefore, I ask that you call for a reinvestment of our funds towards helping save our unhoused friends, and that you specifically put forth a statement recommending a ban on police enforcement of camping prevention laws, especially in cases where children are involved. For too long, we have let profit and property guide our policy decisions, and as the Board of Health and healthcare professionals, we are obligated to take a strong stance based in scientific evidence to focus our politicians to protect our communities and specifically our children. I'm happy to provide my references for review and collaborate with anybody interested in taking a proactive role in fixing these crises.
Thank you.
Thanks.
Great. Next, we have Rosa. So Rosa, I will make you a presenter, and your 3 minutes will start whenever you're ready.
Hi, can you hear me?
Yes, we can hear you.
Okay. Hi, my name is Dr. Rosa Fuster Aguilera. I work at CU Boulder and I live in Boulder. My zip code is 80301. I'm here to ask Boulder County Public Health leadership to make a statement asking for a ceasefire in Gaza. This is a public health issue as it involves a lot of health inequities occurring in Palestine, such as 1.5 million people are without clean water, non-hospital functioning, and given the bombing from Israel, there's forced malnutrition, and in particular the famine of children, and of course the indiscriminate attacks by the IDF that has killed over 35,000 Palestinians, including over 15,000 children, and has left children orphans and many with amputated limbs. To not even mention that this genocide has left many Gazans disabled and no structure whatsoever to accommodate disabled people in Gaza, given that the IDF has bulldozed roads, made access nearly impossible, and all the rubble of the destruction funded by our tax dollars. Some of you might think, why would you have to make a statement on an international issue? And let me address why this is a local issue. First, the genocide that Israel is committing against the indigenous peoples of the occupied territories of Palestine is very damaging on the mental health of many residents of the Boulder County. In particular, the mental health toll that our indigenous siblings are suffering from seeing in real life a genocide like the one their ancestors experienced. This is unprecedented. They are reliving what happened to their families many years ago here in Turtle Island. Not just indigenous folks are experiencing this mental health toll, but everyone with human empathy is experiencing it in some capacity. This is a humanitarian crisis and affects us all. The oppression and occupation by the Israel government to the people of Palestine is a reminder of the oppressive systems that many brown and black folks live here every day. To name one, think about the displacement of Black neighborhoods here in Boulder. I am sure you know about that, but I recommend the documentary This Is Not Who We Are, if you're not familiar with that. The other main reason why this is a local issue is the fact that Colorado spends over 20 million of our federal taxes in funding military operations in Israel, most of which fund weapons. This money could be used for housing the unhoused, funding harm reduction programs, and help with the drug abuse crisis that we experience here. It could be used to stop not only the housing crisis, but the children's poverty rates in Colorado. I want you to really think about that. Coloradans' tax money could be used for this, but it is being sent to fund a genocide.
That's fine.
It's extremely important that you speak against
Thank you,
this
Rosa.
genocide.
That's fine.
Thank you.
Next, we have Lindsay. So Lindsay, I'll make you a presenter, and your 3 minutes will start whenever you're ready.
Thank you. Can you hear me?
Yes, we can.
Thank you. I would also like to encourage Boulder County Public Health to make a statement in support of ceasefire in Palestine. Occupation, displacement, and siege are against public health values everywhere. And it's important that the global professional community speak up. This is particularly true in a sector that's working to repair historical complicity for displacement, institutional abandonment, all closer to home. And in this context, commitments in solidarity with displaced and oppressed people abroad are important. Further, like other people have talked about, our tax dollars paid to the state should be spent to secure public goods and basic rights and advancing community well-being. So food, housing, medical care, education, harm reduction, reducing poverty, you all know, rather than advancing occupation, displacement, and siege, famine abroad. And locally, we need a public health system and a local public health workforce committed to the values of public health. We need people who are going to work to advance community well-being and people who are going to be crystal clear that displacement, occupation, siege, starvation, famine, they're not okay here and they're not okay anywhere. And particularly, we need you to be clear in your commitment to them. Also, anti-Semitic and Islamophobic incidences are increasing in the county and across the state. And local leadership taking clear policy stances and clarifying misinformation can help de-escalate these incidences. Finally, our rights to protest and free speech are being degraded and surveillance of residents is increasing, something that has disproportionate health impacts on Black and Brown residents. People are being arrested and jailed for protests all over the country, including very nearby. And as public health gets clearer and clearer on the connection between incarceration and public health, we ask that you take a stand on the degradation of our civil liberties that's leading to incarceration. Thank you. I'll give you back my time.
Thank you, Lindsay. And the last one is Aram. I'll make you presenter, and your 3 minutes will start whenever you're ready. Aram Bingham, are you there?
Oh, yep. Sorry, couldn't find the unmute. Okay. My name is Dr. Aram Bingham. I am also a Boulder County resident here to express my concern on the public health impacts of the ongoing U.S.-funded siege of Gaza and the failure of our elected officials at all levels of government to take action that supports lasting peace, both in the Middle East and here at home. U.S. foreign policy in this moment is mirroring our domestic policy by supporting violence and militarism, which has destroyed all of the public health infrastructure in Gaza and led to the terrorizing of Arab Palestinians throughout the Israeli-occupied territories. While here in the U.S., municipal governments are also sparing no expense in violently repressing the peace movement in this country with brutal use of police force on student protesters, instead of using these resources to build up the well-being of our most vulnerable and marginalized communities. This crisis is affecting the health of Boulder County residents on several levels. Firstly, those among us, like the members of the CU Ethnic Studies Department, that have been most vocal in supporting a ceasefire, as well as decolonization and decarceration of the Palestinian people, have been the victims of direct threats of violence and doxing campaigns. Student organizers for peace and divestment on our university campuses have been subject to similar harassment and intimidation by those that support Israel's genocidal campaign. And all of us, taxpaying residents of moral conscience, are facing mental health challenges, knowing that our hard-earned money is going to murder children, families, doctors, journalists, and aid workers in Gaza, rather than supporting the well-being of our local community through housing, transportation, and climate initiatives. Despite our persistent efforts, our city councils are failing to take action, demanding peace from our federal representatives, and often claiming that they don't have time or resources to work on crafting our ceasefire resolution, while they also refuse to publicly criticize our federal officials for prioritizing militarism over public health and community well-being. As public health officials, I ask you to demand accountability from the other parts of our local, state, and federal government by acknowledging that support for ongoing war abroad always has a cost at home. Tolerance of the continued devastation of the indigenous peoples of Palestine sends the message to the indigenous people here that their lives are expendable when it suits the expansion of colonialist empire. It also sends a message to our Muslim siblings and neighbors that their lives don't matter as much as non-Muslim lives. And in the worst cases, it encourages both state and non-state violence against those assembling and speaking out for peace.
30 seconds.
We need to help our Jewish siblings and neighbors that want to conflate anti-Semitism with criticism of the U.S. and Israeli imperialism, which is not all of them, because many of them do already understand this danger, that the censoring of pro-Palestinian speech and expression is causing more divisiveness and toxic anger that then spills into violence than the growing calls for peace, human rights, and divestment from the war machine. As a body that purports to understand structural racism, health justice, and supports indigenous rights, as exemplified by a prior resolution on Standing Rock, I hope you will see fit to commit your time and resources to peace, home and abroad.
Thank you.
Yep.
That concludes public comment.
Okay. Thanks to everyone from the public who joined us this evening to share your comments with us. Item number 2 on the agenda is approval of the April 8th, 2024 regular meeting minutes.
I move that we approve the April 8th, 2024 regular meeting minutes.
Second. Favor? Aye. Minutes approved. Item number 3 on the agenda, program spotlight, climate justice and coal ash update.
Welcome. Well, this is the major presentation for this evening, an update on the work that our amazing team and community partners have been doing to address coal ash from the Valmont Power Plant on the east side of the state of Boulder. And here tonight with us, we have Joe Malinowski, Aaron Dodge, Marianne Scheipel, Carl Job, Alejandro Murillo, Mika Kurtz, and Bill Hayes. So take it away.
Great. Okay, well, thank you, Lexi, and thank you to the Board of Health for the opportunity to share this update. My name is Carl Job. I use he, him pronouns. I'm water quality and environmental justice specialist in the environmental health program. Today, we're going to be talking about, just giving an update about the work we've been doing with regard to the Belmont Power Station. I'll start with just a high-level summary of the existing site conditions, as well as the proposed remediation projects that will take place. I'll turn things over to Aaron Dodge to talk a little bit more about community engagement work we've been doing specifically. So if we could go ahead to the next slide, please. We'll start with just directing your attention to a couple maps here. So the small inset map in the top right corner there, that red rectangle shows the approximate location of the Belmont property, just outside of the city of Boulder in unincorporated county. And then if we look at the satellite image here, I've pointed out a couple different key features of interest. So down here in the southern extent of the property is the former power station, the historical coal and the production of electricity going all the way back to the mid-1920s and continuing through 2017. That coal that was burned there produced coal ash, and that waste was historically disposed of in a coal ash landfill. So you can see that delineated in the northwest corner of the property there. There's roughly 2 million tons of coal ash buried there in an unlined landfill. And then just north of that, we have the Belmont Butte, which is holds a lot of historic and cultural significance, especially for our community's indigenous populations. So if we proceed to the, oh wait, I'm sorry, go back to the previous slide. I forgot we took that one out. The coal ash landfill is an unlined landfill, which means there's no protective barrier in place to protect the environment. And the groundwater in this area is fairly shallow, and so groundwater has been in contact with the coal ash for quite some time. As a result of that, there's been subsequent groundwater contamination in the area. Now, the Environmental Protection Agency has regulations governing the management of coal ash. That includes the coal in this coal ash landfill here. And those requirements from the EPA required ongoing groundwater monitoring that started back in 2017. And ultimately, the results of that monitoring activities prompted the EPA to require cleanup activity to take place to protect the groundwater. There are a number of private well owners just north of Belmont Road who are kind of in the direction of the groundwater flow. And so as contaminants begin to move to the northeast, which is the prevailing groundwater flow direction, there's some concern about water quality in those domestic wells. So Xcel Energy, the property owner, is now pursuing project approval and the necessary permits at the state level to implement the project. Boulder County Public Health, we don't have a super active regulatory presence in this space. Most of that authority falls with either the EPA or CDPHE. But we do see a role in the community engagement space in particular. So if we go to the next slide, please, you'll see that red outline again is the Belmont property, and these areas shown in blue are delineated disproportionately impacted communities. CDPHE has identified those areas. And then the orange points represent mobile home communities in the area. So given the absence of any significant community engagement process at the state level, we've stepped into this space to kind of undertake that ourselves. And I'll turn things over to Aaron to talk a little bit more specifically about that process.
And before we jump to that, I know you all read the director's report most likely, and just wanted to see if you have any questions about the work, the plan to do some like pump and treat of the groundwater, as well as like excavating all of that coal ash to try to use it as a beneficial reuse, essentially, to create that cement product. Before we jumped in, I just didn't know if you all had any questions about that or clarification. It's a lot of information.
Not so much on that, but how did you determine the blue areas for your disproportionate impact?
Yeah, that's a great
As
question.
you're jumping.
So these are broken out by CDPHE. The Environmental Justice Act that was passed a number of years ago required the state to go through a process of kind of reviewing different demographic data sets and compile these identified census block groups that meet certain criteria thresholds. So these shaded blue areas meet certain criteria that the state's laid out for meeting the definition of a disproportionately impacted community.
They have like an online tool, EnviroSpring. Yeah,
Mhm.
EPA has something similar, so there's a few different tools out there.
But how is it impacted by, say, a radius or the groundwater distribution from the coal ash?
Yeah, that's a good question. So the specific census block group here isn't directly tied to the environmental exposure potential. The groundwater contamination is largely concentrated on the property, but the monitoring has shown that the plume has slowly started to move to the northeast. So there's a little bit of the plume that kind of is extended just south of Belmont Road towards the northeast of the parcel. But this particular area, the disproportionately impacted community, just indicates that there are, broadly speaking, community members in the vicinity of the property that meet that criteria.
It sounds like the proposed remediation is sort of like a novel way to do this. Like there have been other communities that have done it, but not any locally. Do we have any information? It sounds like it's a very like risks benefits decision here, right? Like it's not a risk-free process to do that, but we think that like overall it's, net positive. Do we have access to like that decision-making process? I'm just curious how they got there to say like it's worth this risk.
Right. So I didn't introduce myself. Sorry, I forgot to do that for the record. Erin Dodge. I am the water quality program coordinator, and that is true. There is a lot of coal ash remediation taking place from spills or other landfill issues, and a lot of it looks more like excavating and moving it somewhere different. This process will be definitely different. There is a site in Canada that is doing something very similar. And so it is novel. We don't know of anything, definitely nothing in Colorado and nothing in our region. I don't know. I think that it makes sense, right? Like there's a need. We have a lot of concrete product shipped in from other parts of the country and resources to make the concrete. So in a way, I definitely see how they came to this conclusion that it could improve, create a local market and, reduce greenhouse gas emissions. And you can list a whole bunch of things that they could tout for that. But it's also better than like digging it up and putting it in somebody else's backyard. So it does stabilize it. There is, it is proven, like there's sites where they're actually using it at the point instead of taking the coal ash to the landfill, they're immediately creating this cement product. So the cement product itself, and that's actually, so it has to go through this beneficial use determination process at the state. And the using it at point of generation is considered a it has like a, thank you, yeah, like a pre-approval. So they don't have to go through this, but because this is going to be excavating all of this coal ash, like close to 2 million tons, they have to go through a complete like approval process with the state that's part of what this community engagement process is.
But they're planning to keep it on site, like
they'll dig it up and then they'll create the cement product and then that will get hauled off to the local markets. Mm-hmm.
And the proposal came from Excel to do this and then
Correct.
to work that
Yeah, they have
approval with EPA and CDPH.
Correct. Yep. Yes. So, and there'll be plenty of time for more questions. I just wanted to make sure as we start jumping into the next piece of this that there wasn't clarifications because we're going to go way far down the road here. So, do you want to jump to the next slide? Thank you. So this slide might look familiar. Back in November, Heather Crate and Kevin Ma came and talked about HEC and the work that they're doing around community engagement. And so I thought this was an opportunity for us to kind of utilize this model because it's familiar and kind of what we're trying to create within public health when we look at community engagement, and talk about an example that's a little bit different than just going out to get input or bringing people to the table for our own internal planning. This is a regulatory process. So there's lots of rules and things that we have to follow that, statutes, limitations and things like that, that we have to sort of fit into these timeframes. And historically, when we've had these comment periods for like a process like this, it's like, okay, the regulators have done their internal review. We've gotten complete documents. It's 30 days, people, 30 days. Tell us what you think. And it's never really enough time for the public to even digest what is happening out there. And so as we've been engaged in this as staff since, what was that, 2017, pre-COVID, we have been hired consultants to look at some of this and the different reports that Excel has been doing and providing. And it started to really become apparent that this area deserves, and the community deserves, a little bit more. So we started thinking about how do we inform them ahead of time? It's a little bit of a slippery slope because we also don't have all the information. We don't know when the public comment period is going to be. So working with the community and trying to create that transparency of like, hey, we are trying to do this different. This is not going to be perfect. We're trying to learn. And how can we bring you information more simultaneous to when we're getting it and prepare you alongside of us? And so that also we're not sitting at our desk thinking like, well, we think this is what's best for the community. So this is going to be our comments from a regulatory perspective. This is what we're going to push for. We think we know. And so it gives us an opportunity to amplify, if you will. And I think we can probably jump to the next slide. And just before we do, we're definitely in the informed phase here, and we're quickly moving into the involve. And I feel like we have the goal of where that yellow star is to really create the space for the community to engage in this process, because I don't think it's really been very, very accessible to all community members. I think that it's, the Board of County Commissioners and their hearings, I think, is more accessible to some, but still extremely inaccessible to the people whose voice we really need to hear, and the people who are going to be living around this and really impacted by the potential project. So as we jump to the next one, this just kind of outlines some of the roles and goals of some of the work we're doing. And I really feel, being able to amplify the community's voice, not only through their own comments and helping them understand so that they can, and then also, maybe it's educating the community members about how to get that in front of them, as well as working with the state agency on creating a process that to receive feedback. Maybe it's written, maybe it's a video, creating a virtual space to provide spoken testimony or comment, as well as us bringing collective comments from the community when we have our opportunities to work with the regulators and sort of, provide feedback or direction or asks of Xcel Energy and their contractors for, what the control measures are going to look like on site. So it took off pretty quickly. I feel like I've been thinking about and talking about this for a while with various people throughout the county, and to have some staff to help bring it to fruition has been really amazing. I do want to say Carl's position is newer, and Marianne as well. And without the two of those positions, none of this work would be possible, because it has been something that I jump into and I have capacity for like maybe one day to dig through it and try to, read a year's worth of analysis from Excel. I mean, how long was the assessment of corrective measures? Like
It's like 500
pages.
I like the document, yeah.
And we don't actually have staff that does solid waste. And all of this it's groundwater contamination, so it hits water. But these are solid waste regulations, and we have 0 FTE really. It's Bill Hayes and myself that jump in and provide support in this space. So having the sustainability tax to help fund this position, and then the agency support to fund Marianne's position has just been absolutely invaluable. So I'm going to hand it off to Marianne, who's going to talk about what's actually happening in the community engagement space.
Yeah, hi everyone. I don't think I've met any of you before. I'm Marianne Scheipel, the Climate Justice Program Coordinator for Boulder County Public Health, of course. So how we're doing this work, how we're engaging with the community. First, we started off with connecting with community leaders in and outside of government. As we know, this county and the city are doing a lot of work with our mobile home community. So aligning efforts with them and canvassing and going to the mobile home parks to, not overwhelm the community too much. So aligning those efforts and working within government staff, as well as with engaging mobile home community leaders. Well, I would say we're connecting with community leaders that engage with and support the community around the mobile home community was like our first intention. So in this case, as Carl mentioned, the mobile home communities, and he touched lightly on there's some Native and Indigenous communities and groups that host currently sacred ceremony around the site, like literally sharing a fence line. Businesses, institutions, and of course the residents that live nearby. For the first meeting, we collaborated with the Climate Justice Collaborative and Naropa University. And this, I can't stress enough, was so pivotal, like so great for us to get community members to show up to these meetings. That really supported that effort. We give out honoraria to disproportionately impacted community members for the public meetings, and we're going to touch more upon a Valmont community-led commission that emerged as well. But unfortunately, honoraria is needing to pause, and we'll touch on this later because we need to create more internal policies and secure funding for honoraria, as well as providing food, childcare, and language justice access to all of these meetings to ensure people are able to understand, they bring their children, and there's dinner provided.
Can I ask a quick question about the residents and the businesses that are identified within the impacted area? Is that all unincorporated Boulder County, or is there anything that falls within the city of Boulder proper?
There's, businesses and mobile home parks within the city
That's considered city land. Okay.
Yeah, pretty much like as you get east of
55th.
Street, yeah.
55th Street, so.
And like Stasio Ballpark, I can't remember if that's actually in the city limits.
Yeah.
Yeah, so it's a very funky,
Yeah.
the lines are very jagged over there.
Thank you. Sorry.
No, thank you. Oh, next slide, please. So this is a photo of our community engagement meetings. We wanted to share what we've done so far. So again, the initial outreach was for disproportionately impacted community, Native American communities. So our first meeting was November 16th. And again, in collaboration with the CJC in Naropa at the Nalanda campus. We want to make sure these meetings are right there and people could come and see the site. Our second meeting was again with disproportionately impacted communities on February 27th of this year at the Boulder Recycling Center. And we began secondary outreach with businesses, residents that are nearby the Valmont power plant. And that last meeting was April 24th of 2024. And we're also doing a lot of digital outreach too. We've updated our Boulder County Valmont site. We've created a Q&A, a live document on the website because we're gathering so many questions at these meetings and there's not so much time to answer them live, or we need time to do research or speak with other regulators. So there's a live Q&A document where we update with when we answer these questions, as well as the public, our communities could ask questions as well. We created a Valmont Station email, so there's just a place where all this questions and communication could live. Supporting community-led Valmont Community Commission. Again, aligning with Boulder County and City of Boulder work, as well as we're, again, canvassing with Columbine, and we're looking next to host a panel with the regulators with community to participate in that. Next slide, please. Oh yeah, now we have Alejandro, because again, I mentioned that in these meetings, community-led group emerged, the Valmont Community Commission.
Hello, how's everybody? Alejandro Murillo. As Marianne said, I work at the Climate Justice Collaborative. I also work over at CU in the Environmental Center over there. And I guess I'm mostly here to just kind of talk about how the Valmont Community Commission, as we're calling it, was formed. The role and really what the opportunity here is for just deep community engagement and building capacity for future efforts. I definitely do want to start with a big thanks because I know Aaron Dodge and Bill Hayes all have been like carrying this for a very, very, very long time. And as Aaron was talking about, the stress of not knowing when to bring this to community and when not to is really hard to hold, especially when you don't know all the information. And so then being able to have this team and come to the community with that kind of open book, I think is a huge step in the way, especially local government is able to handle issues like these and moving forward. Ideally not get into that space of stress. It's all built off of the relationship. For those who don't know, I'll just kind of read off a little bit about what the Climate Justice Collaborative is. This is from our website. It's just the CJC strengthens and supports existing movements and organizations active throughout the county, organizing and building a long-term countywide foundation for sustained action toward climate justice, led by communities disproportionately impacted by climate change. The CJC develops and strengthens networking infrastructure between local government, nonprofit organizations, philanthropists, academia, faith-based congregations, and especially focused on grassroots and frontline-led community groups to unite disparate efforts for more effective, coordinated, collaborative action and climate justice leadership development. Sometime mid last year, we got word about this, about the Valmont issue, about the cleanup. And that was through the connections that we had with government, and particularly with folks from public health and from Oscar at this point. At that moment, we also kind of entered this phase of like, okay, we're not totally sure what to do with this information, but we know something needs to happen and the community really needs to lead the work as well. So in that, we worked closely. Marianne mentioned those two large community engagement efforts. The first one in particular was coordinated heavily by the CJC, including finding space and not recruiting, but I guess finding many community members to show up and just see and learn from these folks in particular. From there, it was recognized that we needed to start essentially a smaller group that was just community organizers to have space in between these larger meetings to think through what is important, what do we need as a community, how are we going to communicate this to the folks around us, and in a way that really does come from community. As awesome as these people are, there still is this role that needs to come from community first. For us, there's just losses in communication and translation and whatnot. So from there came out the Valmont Community Commission. And in that group, not only has representation from all these people, but I also want to just thank them immensely because they are people that have been working in these communities, that are from these communities. And quite honestly, the work that the CJC does and has allowed for in the Valmont Community Commission would not work at all without the years of relationship building that these people have. And being the collaborative that we're here to just kind of support those groups. We're not here to necessarily take credit for any of the work that they do. And that's why I want to name them now. But particularly the organizers like Susana Rodriguez and Jose Garcia in the San Lazaro community, Renee Hummel and Foster Goodwill out of the Vista Village community. Here with us today, Maya McHammer and her colleague Kat Price from the Boulder Watershed Collective has been instrumental. They've been doing a lot of work in San Lazaro, especially around water, health, and I believe you probably are already connected in some form or fashion. Big props to Isabel Sanchez with their community-led preparedness trainings for climate emergency project, using essentially climate emergencies as a way to build community and create greater resilience. And that's shown with the Excel power outage that we had the other day, but then also is really key in this organizing these communities. Eco Arts Connections and Marta Kern, who's been doing a lot of work in the San Lazaro community. Flows with India Love and Gabriela Galindo. And Harvest All First Nations has also done a great effort in bringing out folks from the indigenous community to be there. So in terms of the work that commission and we've been doing in really collaboration with public health, again, we've been meeting with lawyers, we've been meeting with scientists, academics, and finding ways that can be not only just communicated, but that our community members feel like, okay, they're fully informed and then they know where to go. Because at the end of the day, that's really the only path that we can go. And so through that, we've been connected to, other folks at CU Boulder, Environmental Integrity Project, Earth Justice, folks up at CSU as well. And yeah, so with that, the group does meet now. We're trying to get onto a monthly basis. We're looking at ways to prepare for public comment, prepare in case more than public comment arises. Sometimes, as we all know, public comment isn't the most effective way to create change. And so we need to look at the ways that we can do that and the ways that the community members can do that. We know that public health has limitations on the work that they can do, but these community members, if they're informed, if they're empowered, if they're capacitated, they can show up in ways that are much more strategic and really actually help and benefit the work that all these folks are doing. And so, but with that, and I always kind of hate saying this, but I think y'all know that takes money, it takes time, it takes the long-standing and sustained relationships that I think are really starting to happen. And for me, really looking forward into the future, when I first heard about this, I was obviously stressed. I was like, oh my goodness, this is going to be really hard. Here are these communities that are already incredibly impacted. But then it kind of dawned on me, it's like, this is also an amazing opportunity. Public health in particular has this opportunity to develop a relationship with these communities. There's a lot, as I just mentioned, so many organizations are already working, and so it's a great opportunity for them to get organized and collaborate and really just make each other's lives easier. As I look back to the spectrum of community engagement, that the more we're able to have an informed, educated populace, really all of our lives and jobs just get easier. So again, I want to thank you all for all the support, Lexi as well for being there. And, I think really doing some amazing things. I think what this group has been able to do so far is a good bit more leading edge than I've seen in a lot of other local government efforts. And the truth is that we still need to do a bit more. But really just want to thank you all.
Thank you, Ale.
So we have 3 minutes to wrap up the presentation and then we'll get to questions.
Great. I also want to clarify with CU Boulder and CSU, we're aligning efforts with Boulder County Public Health to figure out community-led air monitoring for these communities. So next up, challenges and what we've been learning. Erin touched upon this a bunch of emergent information from Excel and CDPHE's plans. It has been a lot of reports Excel has a lot of reports to submit to CDPHE regarding the design of the cleanup and the dust mitigation strategy. Without this, it's difficult for us to understand the specific impact and to who, without knowing all these details from them. So a challenge we're facing is informing the community of this coal ash cleanup without knowing the full scope of impact and risk. As Erin touched upon, historically, Boulder County Public Health would have waited to have all this information before informing the community. But in this case, that would leave the community with such little time to prepare for public comment periods. So balancing this tension in a productive way is a big learning process for us, and I'm sure for the community as well. Ethical community engagement work in which we recognize the expertise, the time, the lived experience of our community partners. This requires new policies and approaches for communication and transparency, compensation for participation. Again, creating expectation of flexibility to be able to adjust to emerging developments in areas we don't control, sometimes slower, sometimes faster than we expect. The ability to pivot, to quickly summarize complex documents for the community and translate them, of course, ensure flexibility in staff workflows, and build a sufficient but flexible budget for community engagement. And lastly, this work is encouraging the state to think different in the space of environmental justice, because they're allowing us to co-create this public comment period. What will it look like, as we mentioned, maybe videos, what have you, but there's some co-creation there with the state. Next slide, please. It's a bunch of thank yous to ourselves and our community.
Yeah. Just really this, there's a huge team of people working on this, and it has just been a lot of okay, let's just try this different. Let's try it again. That, our first meeting was tough. We learned a ton, got a lot of information out there, but we didn't even make it a quarter of the way through the presentation because everybody had so many questions. So just kind of re-envisioning and really learning while we go. So we've done it without all those people. And there's probably more that are missing.
Marina from last year was really been supporting us a lot.
That's all we had. We'd love to hear if you have more questions or
just a basic question, since it's the coal ash after the shutdown of the plant. Remediation is required, correct?
Yeah, because of the contamination that they have to do something. So yes, and pump and treat is great. It's going to take care of the situation, but that's forever. Who's going to monitor that? They're still generating natural gas there, so they're not planning to walk away from that site or give it up or anything. But that's going to be this is going to be a legacy and a Boulder County legacy. So I think thinking about a sustainable solution and something that would actually move the contaminant out makes sense.
So aside from the concerns around the coal ash dust, what else is being communicated to the community as a concern about Excel's proposed on-site reuse? Is it noise? Is it manufacturing process? Like what are the concerns there?
Yeah, so I think you're absolutely right. There's going to be a lot more traffic. Excel is currently stating that they don't think it's going to be any different than when the plant was operational. I think that is still to be determined. We need more information about their plans. Everything is sort of very high level that has been shared with us so far. Noise, I do think, it's 10 years. They're looking at probably like 10 years of operation. And obviously dust, I think air quality issues are one of our primary concerns in terms of a significant health hazard. But I think CMEX, the issues, I'm sure you've all heard of that one, it's similar, but I think, it's coal ash. So this isn't just dust, right? So we know there's inherently toxic things in our coal ash. And unfortunately, it's only regulated the same as a dirt road dust. Mm-hmm. And we know that it's different. And so I think the push to say, hey, just because we've done it that way for all these years, maybe we should rethink. This is a new opportunity, an opportunity to put more controls out there and more requirements. So,
Well, and we have some of our community organizers here with us, so maybe you have something additional to add.
Who's the ultimate regulator on that? Is it CDPHE?
CDPHE is the primary entity because they actually have additional CCR, coal combustion residual regulations. So the EPA actually is not the primacy. They have, depending on what topic you're looking at, because there's like multiple buckets of issues here. So, but I'd say CDPHE is primary.
And I do just want to add, in part of this process with working with the community members come up with so many questions of all kinds. And having this relationship, we're able to dive deeper into answering a lot of those questions. And so if we're figuring out noise, traffic, health impacts, who's going to deal with that in the future. And so it's really great to have the community members know that they can ask somebody who can figure out what those answers are. And I also believe, me personally, like this one team, amazing, but no one team is ever going to be able to figure out what's everything that needs to be communicated. It's really fantastic, that part.
Questions. First of all, can we see the Q&A page that you guys are doing? Like, can we get the link to it after this? We don't have to do it right now, but
Boulder County, Belmont Station into Google, it'll be the first result. And then there's a related links section in the top right, and there should be like a live Q&A document for click on there.
See that, yeah. It sounds like not only is this like a novel cleanup effort, but like the community.
It's like a PDF document.
So robust. Opportunities for dissemination, conditioning, sharing what you're doing.
Yeah, I think
Can I add funding to that? Because one of my questions is also like, what is the funding plan for ongoing support of the community engagement piece?
I mean, I have a lot of thought, like transparency around that. I think is really important. And like, we also don't want to let the community down in that sense because we can't provide honorary or funding into the future, for so long or something. So I think that's like a real concern. And then, yes, I do think to your point, like sharing this information out will definitely be important. And I think that's like a whole nother level of community engagement. Like, is it really our story to tell? I don't know. Like, it doesn't feel like it. But I don't know, Mary, what do you think?
Oh, I just want to add too, I've been supporting the CJC and looking for grants and for funding for this particular project. What was your question?
Funding and like sharing out like
the story.
Oh, like and what we've learned and like creating like
For other communities who are.
Yeah.
Basics.
Yeah.
Yeah, that would definitely need to be in collaboration with the community and the Belmont Belmont Community Commission group for sure. It's not our story to tell.
And I think that like working with the federal partners, so like in a bigger picture in terms of like what is the actual health impact, I don't feel like we can actually answer that question very clearly. And Bill, feel free to chime in if I say something, because this is definitely air is more your silo, but we've reached out to federal partners like NIOSH, ASTDR, ASTDR, thank you. And to see if we can like understand what the risk is. And so you have to really go into like the constituency, right? So if it's super fine particles, most of the ash, and that's the super fine particles are also where all the arsenic is, that's not great. But if it's like chunky, rocky chunks that where most of the like heavy metals are, better, right? So those aren't going to fly as far. So I think there's just so much information we don't have that we're working on trying to get so that we can be like 10 steps ahead of the actual process of looking at this as a project that's going to have like oversight and, you know, best management practices and requirements that are going to be put on the project team to implement. Go ahead, Bill.
Yeah, and I would add that, you know, we feel confident that, you know, as we started out saying, you know, we're trying to lessen kind of global environmental impacts of not shipping this someplace else, not having train loads of other cement material coming in. But it obviously raises risks locally. But I think, you know, I personally, and I think, you know, the team, we feel that the risks are, you know, we're not seeing anything that's a significant risk. We're not trying to mobilize the public to stop this project. We just want them to be aware of it and give them that opportunity to provide input on it. From an air quality standpoint, as Aaron said, we've got a lot of experience with CMEX. We've got a lot of experience with cement dust. And you know, there are ways to do this properly and to manage it. And I expect Excel to put together a dust mitigation plan. And, you know, it'll just be up to us to make sure that they're actually following their plan and implementing it properly. We are going to be pushing the state for some more robust air monitoring than what a project like this might have received in the past. But what I'm really excited about is we've got partners at University of Colorado and Colorado State University that have said, we've got air monitors. We would love to install them and check this. So I think we're going to have a very robust monitoring plan for air in place for the project.
Also sending all the Board of Health an email right now that has all the different links for the FAQs and directives.
You guys have a question there too? Folks.
Good question. Hand raised.
Micah, go ahead. Mika?
Mika.
Yeah.
Am I muted? Can you hear me?
Yeah.
Hi, y'all. Thanks for hearing my comment. It's not as much of a question. It's also, I just want to add this to our conversation. The fun thing about the screenshot we're looking at right now is that I don't think we're only talking about the quote unquote the fire that we're putting out now, this particular cleanup and the scramble for that 30-day comment opportunity. I think we're also having a discussion about climate justice in the county on a longer term scale, about what kind of county we're looking forward to in 2030, and the fact that already, thanks to the efforts of all the people on the screen right now, we're de-siloing conversations and learning to coordinate and collaborate with one another and prioritizing centering frontline community impact and experience and leadership through it all. And this is something that as we learn to do, we can also enshrine it in our practice for the long run. Not a one-off project, but relationship with frontline communities that thus far don't have a seat around these tables, don't have a voice advocating for their needs because they're in traditionally disproportionately impacted communities on the wrong side of the Boulder city limits. And so this is a bigger picture opportunity. And I want to throw that out there into this room and appreciate that we're having these conversations, because traditionally we don't. This is a big deal. As a community organizer, I consider this conversation a big deal and an important opportunity for longer term thinking. So thanks for the conversation.
Thanks, Mika. About 3 minutes left.
I think I personally forgot as well. I just wanted to add in the work that Mika also does with the Boulder County Climate Justice Hive and bringing on a lot of those partners, including Naropa, Green Faith Boulder County, and quite a few other folks as well. Just a shout out.
Well, if I can be helpful in thinking about potential funding partners, be happy to have a conversation outside the meeting about that. Thank you.
Yeah, that'd be great.
For the ongoing needs of the work, because it sounds like the staff time is paid for by our department and by Oscar, but that we need funding for ongoing community engagement.
Well, and just like even hosting the meetings, like we're trying to do childcare and trying to have, you know, provide a meal and the honoraria, like it's like scraping into the coffers of our, it's just like, I cannot have, you know, anything at this meeting. No more other meetings will get some, you know, so we are just nickel and diming what we have. So it's a little stressful. So it's great.
Questions?
I'm excited about the work you're doing.
Yeah, thank you. Thanks for all of you. It's really important. And we should get an update to the Boulder Reporting Lab so that they can tell a long story.
Yeah, exactly.
I just also want to thank Kate Haywood for providing legal and technical advice to the team. And also Giselle Knoll on our communications team has been exceptional.
Yeah, really a ton of work.
The translation and
Thank you.
Yeah, thank you.
Thank you. Okay. Okay. Item number 4 on our agenda G, and this is a syphilis public health order update. Dr.
Hi there. Can you hear me?
Yes, we can hear you.
Yeah, fantastic. Thanks. Bob Belknap, he, him pronouns. I am the Chief Medical Officer for Boulder County and wanted to give you all an update on syphilis in Colorado. Next slide. So you all may have seen this headline from last month, Colorado taking action to fight deadly spike of syphilis in newborns. So just a little bit of background on syphilis. So it's an infection caused by a bacterium called Treponema pallidum. It is most often transmitted sexually, but it can be transmitted from someone who's pregnant to the unborn fetus. There are several stages of syphilis, so primary, secondary, a latent phase. At any stage of syphilis, it can affect the central nervous system, the brain, the eyes, and other areas. Hit it one more time. And any stage of the infection disease is actually still treatable with penicillin. Next slide. So we've actually been experiencing increasing rates of syphilis across the U.S. for about a decade. And so you can just see this is the primary and secondary cases and what's occurred between 2013 and 2022, and darker as increasing rates overall. In Colorado, we have experienced this. Next slide. And here's just in the last 5 years what we've seen. So 1,400 cases of syphilis diagnosed in 2019, up to almost 3,300 cases last year. Next slide. And importantly, where we've also seen an increase is in cases in people during pregnancy and subsequently transmission and congenital syphilis. And so last year there were 50 cases of congenital syphilis in Colorado. Hit it again. And thus far in 2024, we're already up to 25 cases. And so on pace to have more than we had last year. And that includes 7 deaths have occurred as a result of congenital syphilis this year. Next slide. So the Colorado Department of Public Health and Environment put out a health alert on April 1st with updated recommendations. And it was based on this information and included some new screening recommendations in people during pregnancy, but also at other times in at-risk populations, defined largely as adults, adolescents and adults, so people between the age of 15 and 44. Although certainly we see syphilis outside of those ages as well. Next slide. And then just 2 weeks after issuing the health alert, the state health department issued a public health order. And the public health order states that all healthcare facilities, providers, and correctional facilities that medically evaluate and treat pregnant patients for any reason, so not just for prenatal care, must offer and provide syphilis testing in the first trimester, third trimester, and at delivery unless it was already done or the person declines. And so this was an important step. And I'll say that I've been working both in Denver Health, where I'm an infectious disease doc, but with other area providers and health systems on exactly what does this look like and how does this get implemented. So next slide. So I did want to just provide a little bit of information on Boulder County. And so if we look at the Boulder County births over time, they have been declining for the last 20 years. I didn't have this data when I put the slides together, but I do have some data on syphilis in our population in Boulder County. The number of cases of syphilis have not increased proportionately as what we've seen in the state. And so it was 41 in 2019, it was 43 in 2023, and sort of bounced around slightly higher in the 50 to 60 range in the years in between. There have been, over that same 5-year period, there were 2 cases of congenital syphilis, so one in 2021 and one in 2022, none in 2023 and none in 2024 so far. And so wanted to give you all that information. I think that's my last slide. Go one more. Oh, no, I'm sorry. I did include, so there's some data on prenatal care, and this is important because the investigation on the examples where there have been congenital syphilis and certainly where there have been deaths have revealed largely that it's in patients who aren't accessing care, so aren't getting prenatal care. And thankfully, most people in Boulder County are receiving prenatal care, and this just slide shows that. It's the numbers of that either aren't receiving or the unknown status are low. And so the reason for the public health order is the recognition that we need to get more testing into areas where it's not being done. And in fact, oftentimes folks where there were missed opportunities, where patients were accessing emergency or urgent care for reasons other than pregnancy, and so could have been tested and weren't at that time. So that was the background for why the public health order was issued. Next slide. And that was my last one. So I will stop there and take any questions.
Question. So I'm seeing this in my medical news feeds almost daily, the national issue with syphilis and especially congenital syphilis. But there hasn't been much conjecture that I have read about why the rates are increasing. I think just today there was an article suggesting that because of potential penicillin shortages that is being identified but not treated. Have you heard does CDPHE have any ideas about why the rates are going up?
Yeah, thanks. It's not entirely clear. I'll say it's the numbers of cases are still higher in men who have sex with men than in women or people who are pregnant. There certainly is at least an association with substance use and substance use disorders, and so the impacts of the opioid epidemic intersect with this significantly. So that is clearly a factor, and then access to care in general. And ease of access to medical care. I don't think that the penicillin shortage, at least not in our communities, has been a driver of this. We've been able to manage it, and it's been, I think, rare where we've had to use the alternative, which is doxycycline, oral antibiotic, and currently the penicillin supplies are better than they've been. So I think all sites that I'm aware of are back to using penicillin for all. So there was a brief period of time in our own sexual health clinic where penicillin was being reserved for people who were pregnant or people maybe more likely to become pregnant or to have more difficulty with following up or adhering to treatment than those folks were getting penicillin and others were getting doxycycline. But we're using penicillin for all now. Something else that's increasingly being deployed and is a newer tool is a rapid test for syphilis. So that a test that can be done in the field. It's combined with a rapid HIV test. It has a number of limitations. If a person's ever had syphilis before in their life, it's not useful because it can't differentiate between previously treated syphilis and active syphilis. So you still need to do a blood draw and send it to a standard lab to be able to tell the difference there. But it does offer some opportunities to get more testing potentially into communities, and then coupling that with treatment and connection to care and ideally follow up are all important components of this.
We have 5 minutes left.
Oh, you guys, I have a question. Go ahead, you guys.
Any more questions?
Well, you sort of answered my second question. We're talking about the rapid test, but besides that, has the state updated any of its guidance outside of pregnancy or dealing with the uptick in syphilis?
Yeah, the health alert that they put out in early April was much broader around testing and getting more testing done in people who may be at risk, which sexually active adults, across the board really, and getting that testing happening in more urgent and emergent care. So the public health order only covers people during pregnancy, but the broader recommendation. And so I think the public health order is going to help to move that along. It's some of the challenges in talking with colleagues who work in emergency departments and in urgent cares has to do with just how do they make that happen? One, how do they have that conversation? Someone comes in for an ankle injury, and you tell them, okay, now I want to test you for syphilis. So just figuring that out for them. And similarly, if someone's coming in for something that might be a 10 or 15-minute visit and wouldn't involve any blood draws, now drawing their blood and getting the results and following up. And for most, it's not a one and done treatment. There's follow up afterwards, and that's not typically done in emergency department settings. So for folks who don't have primary care providers, how do you ensure that follow-up? So there's a lot of work that's happening to try to figure these things out. As with many things, one of the limitations certainly is the funding for that work. Then if people don't have insurance and don't have providers and don't have follow-up, then how do we ensure that they get access to the care they need?
Thank you.
I don't necessarily have a question. I appreciate that you're bringing this both to the board's attention and to just the public's attention. I practiced in Boulder County for a decade and never once saw a case of syphilis. And now I practice at Denver Health, and certainly we see it on a regular basis now. I think what the public health order is telling us is that no providers can consider their population low risk any longer, right? We can't just assume like, I'm only going to screen at the prenatal visit. I have a low risk population. I'm not going to do it again in third trimester in the birth admission. And I think what we have the opportunity, and especially because we just met with hospital administrations Australia just last week, screening during the birth admission is very new. Like it's something that is not common practice at all. And I think for many hospitals having workflows for not only the screening on admission and making sure that's part of standard admission order sets, but you're right, coordinating the outpatient treatment. I think there's a lot of social determinants of health concerns with outpatient follow-up. The treatment isn't a one and done situation, right? Like it's more than one visit to get adequately treated. And so considering transportation issues, access to healthcare issues, especially with maybe new parents with an infant at home and other childcare issues. I wasn't aware that the Department of Public Health CDPHE has like a home visit program for treatment. Did I see that in the director's report or somewhere else in my other life? I don't remember where I saw it, but they have a home visiting treatments program now. And so I'd love for us to, as a county, learn more about that and see if it's accessible here for us.
They do have that. It's relatively new and it's fairly limited, I'll say, in terms of its scope and scale. But it is an added option that I think has some promise. And so I'm happy to bring more information. I don't have any numbers behind it. I know that they're still figuring out some of the logistics and details. I think certainly one of the greatest challenges and with the missed opportunities has been that the people, if you don't make a diagnosis and get someone at least started on treatment in that emergency department urgent care visit, the contact information, the ability to find people afterwards is really difficult. And so we've been working with the emergency department at Denver Health for a few years now, more broadly on increasing testing for syphilis, not just during pregnancy. And our sexual health clinic will follow up on anyone with a positive test. And so these aren't using a rapid test, but using a traditional lab-based test. And it's, I want to say a third of the time, up to a third of the time, the information that we have isn't accurate, or we can't reach it. Maybe it's accurate, but we still are unsuccessful at actually finding the people or getting them to respond and to phone calls and other things. So having home visitations is going to be helpful, and it's going to take a whole lot of probably different new processes and flows and engaging with broader providers and the community to really turn this around from where it's gotten in the last decade.
Patrick said it's not in director's report, but on CDPHE's website, they have field delivery therapy. So they'll take medication to the field, which is typically their home.
I just have a quick question about CDPHE's public health order does not change like who's paying for these tests, right? So is it already covered by Medicaid? But as you noted, there is no support for uninsured people who are asked whether or not they want to take the test. They'd have to pay for that out of pocket.
Yeah, so there is some free testing provided from the state for folks. So it's not that the testing is not entirely out of pocket. It doesn't cover the cost of medications for people who test positive. So that can be a barrier and a challenge. It did change, the public health order did change some of the coverage for testing during pregnancy, because those tests were not all covered by Medicaid at the time. So they did work with HCPF prior to releasing the public health order to ensure that the tests would be covered. And you know, all people who are otherwise uninsured are eligible for Medicaid during pregnancy. That does require someone to have engaged in some level of care to get onto that. It doesn't, you know, it doesn't just kick in at a positive pregnancy test. So there's a process involved there. So that can be a gap as well.
Well, thank you.
Sorry, Kelly, did you have something?
Do we have time, Jordan? You,
I want to say 2 minutes.
okay, great. Dr. Belknap, this is Kelly Hinch, Strategic Initiatives Director. So, to me, this is like a classic public health work, right? Much more, frankly, than hospital providers or to such. And do you feel that part of the reason we've seen an increase, you talked earlier about there seems to be a skewed a little bit more to men having sex with men. Do you feel that there's stigma involved in this? Well, there's stigma involved with any STI, right, for people and their healthcare seeking behavior, and in particular with men having sex with men, or any sort of the LGBTQ population that may not feel comfortable with healthcare providers, that and may not have, you know, resources coming out to the community or whatever, right? Then there may be men who are married men and having sex, you know, outside the marriage or whatever, and things like that. So there's lots of different reasons. Do you feel that that's also a drive, that sort of stigma in that space? And yeah, no, let's just go with that. This is a huge public health issue for me.
Yeah, thanks, Kelly. Boy, short answer is yes. I think that stigma is a big part of what prevents people from seeking care. In addition, it's not something where people may be symptomatic or may not be symptomatic for long if they get an initial lesion or rash from the infection. That can go away on its own, and then the infection continues unless someone tests and treats. So that's certainly a challenge. It's a challenge that has come up with this with the rapid testing. Interestingly, in talking to our outreach team that does go into community and does testing, and using the combined test that is for both syphilis and for HIV. If you're working with a population, you're working with people who know they have HIV, it can be difficult and in some cases traumatizing to get tested and have to see that positive HIV test again. So we've had people say, I don't want to get that test for syphilis because I don't want to see that HIV test. Or similarly, people who know they have had syphilis before don't want to get another test that's positive for syphilis. We know that it's not helpful because it's going to be positive for life if you've ever had it. And so it just contributes to the challenges of trying to get people diagnosed and treated effectively as early as possible, which is really what we need to prevent transmission and to reverse these trends. So there's a long answer for a short answer of yes. Stigma is a big driver of this for sure.
Well, thank you, Dr. Bob, for updating us.
Yeah, thank you all.
Bring attention to it. Okay, item number 5 is director's report.
Short and sweet, just to raise a couple of issues up to your attention. Indira Gujral is leading a regional health systems collaborative that existed before the pandemic, but was somewhat suspended. And it involves most, if not all, of our regional hospitals. We're doing it with Broomfield Public Health. Mental Health Partners is there. Both of our FQHCs are there. And thank you, Board Member Fagan, for representing Clinica at the meeting. We're looking at the Hospital Transformation Project as a center of the work to focus in on what might be most beneficial that's aligned with our strategic initiatives and their needs. I will tell you a couple of new issues are kind of beginning to rise to the surface on our radar as critical community issues. One is that the Medicaid drop-off continues to get worse. In Colorado, something like 67% of the folks that have been dropped off Medicaid were dropped off due to administrative reasons, not because they didn't qualify. And the state is looking at why our automatic enrollment system performs so badly compared to other states where it can perform extremely well. And then the other issue, a little more topical, is the problem of alcohol misuse across the state is quite significant. And that might be tied to our mental and behavioral health work. So 2 issues just to keep on your radar that will probably be coming back to you with. And that's it for the director's. Unless you have questions.
Questions from board members about director's report? I had a question. So the budgeting for equity that's in here, is that something that we'll discuss later?
Yes.
Okay.
Yeah, I can give you a 15-second synopsis. It is really an intention to be more intentional. It is an effort to be more intentional about what we are kind of dedicating our funding to, and with the adoption of our strategic priorities and our public health improvement plan, with some of the budget conversations, this is, an important opportunity for us. It's a useful tool for us to just be very conscious of how we're using our resources in the best way, and we will absolutely be coming back to you with it. It will also probably will be able to tell you how we use the tool at the budget study session in August.
Also with the food freedom movement and now the avian flu in dairy cows, are we putting out any messaging around pasteurization and potential issues with consuming raw milk?
That's quite an intersection of issues given the recent politics around that. So my understanding is that the avian flu issue is not impacting Boulder County, but I do think that the point that you make is important because, well, maybe Joe wants to speak a little bit to that.
So you're right. It sounds like the biggest risk is from unpasteurized milk. I know the state's put out a list of all the unpasteurized dairies. People are selling that. I don't think we've done any direct messaging, like a press release or anything like that. I've actually been out for the last week, so I'm not sure. But, they don't seem to be raising a big alarm about it now, but I think it just reinforces this whole thing about, there's even legislation this year to try to advance the unpasteurized milk. So to me, it's actually, it does highlight the need for people probably not to be drinking unpasteurized milk. Unpasteurized milk is safe, so.
I'll check with the team and whether they have anything in the plan.
I have a question about the works program. In the director's report, it said that state legislation looks like it will pass to support drug checking. And you're working on protocols that the legislation will for. I don't know what drug checking in that context mean, like drug screening, like substance use testing, like, do we know?
So as an example, we have fentanyl test strips that allow checking pills to see if they contain fentanyl.
I see.
Yeah. That's what a jet
And
drug
that's what
checking.
passed through legislation recently, or?
Yes, and I think it's gonna be some time before it takes form. Because there are a number of, there's legal, administrative, technical issues with all of it. Kate, do you want to speak to that? I know you worked on that a little bit with our team.
Yeah, the county attorney's office has spoken with members of the Works program to sort of understand their vision and, just share some of our initial thoughts. You can imagine what some of the county attorney's office concerns might be, so we're just going to continue to work through it and, do the best we can with what we have. Thank you. Questions on the director's report? Okay, thank you. Item number 6, old and new business.
None tonight.
Anybody else have any surprises? No. Favorite part of the meeting? Okay. Item number 7, this meeting is adjourned. Thank you, everyone.
Thank you.
Thank you.
I don't know that.
Think about